Thank you for joining us today. Today's webinar is EHR Tips and Tricks for My Vision Express, how to take exam room efficiency to the next level.
My name is Denise Ramos. We'll get started with how does personalizing your EMR maximize exam room efficiency. A key factor in personalizing your EMR is actually setup. Setting up your EMR will decrease the amount of time you spend entering information during an examination. It'll also allow you to breeze through an examination quickly. This will increase patient volume, and then it'll also increase your revenues. By setting up your EMR, it'll actually increase the time you can dedicate to your patient's needs. Most of what will be discussed today can be done without the use of Customizer. What can you personalize in the EMR? You can personalize clipboard categories, exam categories, regular categories, and you can also create exam templates. This would be perfect for multiple doctors and also for multiple types of exams. We're also going to discuss some workflow as well as some extra features that My Vision Express offers, which will also increase the time that you spend with your patients and also decrease the amount of time you spend entering information. We'll start with Clipboard Categories. Clipboard Categories will allow you to conveniently add commonly used notes throughout the EMR. You can do this through any tab in the EMR as well as in the patient profile. The way to set this up is you'll go to File, Setup, and Clipboard Categories. I've already entered a test here for everyone to see, so you would pretty much just add and then add the category that you wish to have. We do have a sort order, so if you wanted this to be on the top of your list, you can change the sort order. I'm then going to go to File, Setup, and Categories. When I go in here, I'm going to find the category that I just added for my clipboard, and I have here Clipboard Test 1. So I added 2 category items already. Once I'm done adding my category items, I'm going to save, and it's going to ask me to restart the application. So I'm going to press OK, I'm going to log off, and then log back in. I'm going to open up an exam just to show you exactly where these clipboard categories appear. I'm going to go to the Entrance tab, right-click, and you'll see my clipboard and then the test that I did. The next setup that we're going to do is exam categories. Now, the reason why I'm starting exam categories first rather than the exam templates, it's because anytime that you're adding a category to the exam, you actually have to recreate your templates. This will be changed in 11.0. So if you haven't done your exam categories or your templates, then this is the perfect opportunity to look at these 7 sections that I'm about to mention and see if there's anything that you wanted to add or modify. This would be perfect for other tests if they're not available currently in My Vision Express, in the categories, or even a treatment plan. You can modify anything, add anything, and you can even inactivate some things. So the categories are broken down to 7 sections: binocular, external, internal, other test procedures, review of systems, surgical procedures, as well as treatment plan. For each section, you may add a category type for the specified tab.
So to set up your exam categories, you're going to go to File, Setup, Exam, and Category. As you see, I have my sections from binocular all the way down to treatment plan. Now, if you wanted to go ahead and delete one of these sections or delete one of the categories in the sections, you can just go ahead and delete. For testing purposes, I'm going to go ahead and show you how to add a category. So I'm going to use the external eye. I've already done the test, so as you see the second one, it's test 1, and I even have a sort order. So if you do want this category type to show up on the top or on the bottom or in the middle, you can change it by the sort order. If if you also wanted to copy one of the categories, you can go ahead and use our copy button feature. Once I've added the category, sort order, and my normal text, I'm going to go ahead and save. Now I'm going to go to File, Setup, and Categories. Much like the clipboard categories, I'm going to go ahead and find the new category that I added, which was External I Test 1. I've already added 2 category items, so I have Test 1 and Test 2. I've even also added one as a default. So the way that this will work is if I go into the External tab, and if I click on the Test 1 line, and if I double click on it, then the Test 1 category item will actually appear. Once you've added your category items, you're going to go ahead and save. It's going to ask that you restart the program. So once you do that, log off and then log back in. And since I've done this already, I'm going to just go ahead and jump to File, Setup, Exam, and Template. Now remember that for now, anytime that you make any changes or add to the exam categories, you would need to recreate your templates. But in 11.0, you would no longer need to do this. I've already created a template, so I have my brief exam and Denise's test. I'm going to go ahead and show all the tabs on the bottom here, so all the tabs will be displayed in this example. Once I've recreated my templates or added my templates, I'm going to go ahead and save. Now I'm going to go ahead into the exam module and I'm going to open up the template I just created. I'm going to choose Darwin as my patient. And then I'm going to go straight to the External tab. As you see here in the External tab, I have Test 1 as my second category. Now when I look at my drop-down list, I have Test 1 and Test 2. And now I'm going to double click and Test 1 will show because it is my default value. Remember, when adding a test, you must add in the exam categories the instrument test, the reason for the test, findings, and plans. You may then add to File, Setup, Categories for the drop-down list for each reason for test, findings, and plans that you would like to add. The next setup is categories. Most of the categories or the drop-downs in the exam may be changed and adjusted according to what you would want available. You can default certain categories. This allows you to double-click on the field and have the default category appear. This is exactly what we did in the last example with the External tab. You can also add brackets in categories for multiple choices. When going through the categories, it would be a good idea to look through your examination first and look at all the available drop-downs that are in the examinations. If you're looking through the drop-downs or the available categories and you see that you want to modify some of the categories or inactivate them or even add to it, you can do so through categories. Also remember to make categories inactive as you may need to use them in the future. Now in order to access categories, you're going to go to File, Setup, Categories. I'm going to use contact lenses as an example, so I'm actually going to go to Contact Lens Centration. As you see here, I have category items already available. I have centered, superior, inferior, nasal, and temporal. So what I'm actually going to do, I'm going to add brackets to this, so that way I can have multiple choices. So I'm going to click on add a bracket, and then I'm going to go ahead and add my information. I'm just abbreviating this for testing purposes. I'm going to end it with a bracket. What I'm also going to do is I'm going to click off default, so that way when I get to contact lens centration, I'll double click on that line and then this choice will appear and then it'll also show me multiple choices. So I'm going to go ahead and save. I'm going to click OK, log off, and then I'm going to log back in. Since I didn't do this in my exam categories, I don't need to recreate my templates. So I'm just going to go ahead and jump to a new exam. I'm going to use the same template that I used before. And I'm going to choose Darwin as my patient. So now I'm going to go straight to contacts. I'm going to just add a contact. I'm going to go straight to centration. So now I'm going to double click, and as you see, I have multiple choices. So this way, instead of using the drop down, I can just double click really quick and then choose the one that I'd like, and now it appears. You can use this bracket feature wherever it is available in the examination for the categories, and wherever you see fit. Now we'll talk about exam templates. So after you've done your exam categories and your regular categories and everything looks as you want it for the examination, then we can create our templates. Creating your templates will allow you to display the necessary tabs needed to complete each specific examination. You may take out tabs that you do not want displayed in the exam. You may also arrange the tabs in the order that you find most fitting for workflow. You can also assign a physician to a template, and you can set up recalls in each template. Once in an exam, keep in mind that you can also snap and unsnap tabs on the fly. So if you accidentally chose the wrong template and there were some tabs that you needed displayed or you didn't want displayed, you can quickly right-click and then remove or add the necessary tabs. You may go ahead and add default values within the exam template while creating them. Within certain tabs, there are areas where you are unable to default values, such as intraocular pressures. This can be found in either the Entrance tab or the External tab. Tabs that do allow default values are the Summary, Review of Systems, Entrance, Binocular, External, Internal, Low Vision, Assessment, and Custom Fields tabs. The tab shaded in gray will not allow default values. In order to set up exam templates, you're going to go to File, Setup, Exam, and Template. You previously saw me create one, but I didn't add any default values, or I really didn't do much with it. But I'm going to continue on with the one that I started to create. So as you see here, the exam type, you do have a drop down, so you can choose the type of exam that you want it to be. Now, with the help of categories, File, Setup, and Categories, you are able to change the name of this exam type. So if there is something specific that you wanted to add, like Medicare Comprehensive Exam or IMED Brief Exam, you can always add that in this category. Now I'm going to name the name of the test, so you can also name the test as I have the example here, Humana Comprehensive Exam or Medicare Comprehensive Exam, or even just Dr. So-and-so's exam. So you can always add whatever name you'd like to name the examination or the template. So after you're done choosing the exam type and the name, you can choose the tabs that you want displayed on your examination. So here, if I don't want low vision to appear, or binocular, or even custom fields to appear, I can just uncheck the box. And for those, of course, that you want to have appear in the template, then you would just check off the box. You can also choose the sort, or you can also choose the arrangement of the tab. So if I didn't want the complete tab to be second, I can have that as the fourth tab displayed, and then it'll change the order of the tabs. The next step I'm going to do is I'm going to click on Details. Now from here, I can actually assign a template to a doctor. So if I wanted Ben Franklin to have this specific template, I can go ahead and choose that in the Summary tab here, and it'll actually default this particular template for Dr. Franklin. As you see here, there are grayed out tabs, so as I mentioned before, these tabs you would not be able to default any values in them. Everything else here that you are able to access, you can default values. So now with Review of Systems, I'm going to go ahead and click All Negative. You can also add a surgical procedure, computer use if you'd like, a status of the review of systems. The next, you can go into entrance, default values in here as well. So you can do your visual acuities, your confrontation visual fields, your pupils. You can do EOM, color vision if it applies, stereopsis, pupillary distance. I probably wouldn't do it because it is patient specific, but you can add psychiatric information, and then any notes if you wanted to add in there as well. As I mentioned before, you won't be able to add any default values for intraocular pressures, and this will also appear in the external tab. So this is the only section here that you won't be able to default any values. Now with the external tab, you can have all normal. You can even have a normal value for pachymetry. And internal, you can do all normal as well. You can choose your pharmaceuticals if you commonly dilate patients with the side effects box discussed checked. You can choose your exam method, your disc size, and then CD ratio, AV ratio, if you'd like. Keep in mind also, if there's a specific exam template that you're creating and there is a common finding in the internal or in the external or even the review of systems, you can always add that in here and it'll show up every time that you open up that template. And then finally in the assessment tab, you can add recall dates. So I can go ahead and click this arrow here with the return to office in a year, and it will automatically default a date anytime that you open up that exam template for that recall to show up for a year. You can also do the same thing with recalls. So if I wanted the patient to come back in a month for this particular template, I can go ahead and do so here. If it was a template where you commonly refer a patient out to a specific outside physician, you can go ahead and default that here as well as the reason. Lastly, for each template that you're creating, you can default procedure codes. So if you know that this is an established exam, or if it's a new patient exam, you can always add those procedure codes on there. So for this example, I'm just going to go ahead and put, since it's an existing, I'll do intermediate exam. So now anytime that you open up this template, this procedure code is already going to be there. So that way the doctor doesn't have to worry about that procedure code not showing up. Once I'm done adding my default values, I'm going to go ahead and save. Now my templates are all done. So I'm going to exit out, and then I'm going to go back to exam, and I'm going to choose a template I just created just to show you how it looks. So I'm going to choose brief exam, Denise Ramos. I'm going to choose Darwin. And now I have my default exam. So my physician shows up. I have my review of systems already recorded, my external already recorded, my internal already recorded, as you see my exam method, my side effects discussed, and also pharmaceuticals, disc size, CD, and AV ratio. And in my assessment tab, there's my procedure code, as well as the referral and the recall dates. Now, if anything changes within this template or for this particular exam, so if you're not going to refer the patient out to another doctor, you can always erase it. The same thing applies for external and internal and review of systems. If there is a finding, you can change it and you can go ahead and add that value in there, or if you didn't dilate the patient, you can go ahead and erase it. Now that we've covered the setup for clipboard categories, exam categories, categories, and exam templates, I did want to touch base on some workflow. So I've noticed that with the refractive and the contact lens tabs, some doctors are having a bit of trouble of understanding a better workflow for it. So I did want to share that with you guys because I feel like it would help you guys a lot while you're in the examination, and there's easier steps to do rather than retyping each refraction or each finding. I'm going to start off with the refractive tab. So when adding a prescription, you may click on Add. You will see the details appear, such as the RX type, usage, and lens style. This would be beneficial for presenting prescriptions, especially if you have those multiple presenting prescriptions. So at least with the usage and the lens style, you can tell whether it's distance or if it's for near or if it's a bifocal or progressive, and also the type of lens style that they're used to. Now, for each refraction, you may use the Add button, but an easier method would be using the Copy feature to copy the refraction and adjust when it's needed. So I'm going to go into the refractive tab. I already have my exam open with Charles Darwin, so I'm just going to jump into the refractive tab. So I'm going to start off with the presenting prescription. So I'm going to go ahead and click on Add, and you'll see on the bottom now I have my details. Now, keep in mind I do have this filter feature, so I would be very cautious about this. I've noticed that some people mistakenly think that this is where you add the information. So just be aware of the filter feature, because it does say RX type just like how the details does here, and it does have the same choices. Now, when you are adding a prescription, I'm going to go ahead and click on Presenting, and I'm just going to go ahead and add my presenting prescription. My usage, I'm going to make this a distance prescription, single vision. Then I'm going to add another one. This time it's going to be a reading prescription. So the lens style, I'll also use single vision. And then you can also see here, depending on your inventory, the type of lenses that appear. Now next, I have my presenting prescriptions, and also if you've noticed, I do have my visual acuities. So this is a nicer way to view that visual acuities along with the actual prescription, especially for those multiple prescriptions that patients might bring in. So this is another place that you can add the visual acuities with that actual prescription, rather than in the entrance tab you have your aided acuities with your glasses and your contacts. And also the presenting prescription does appear here. So now my next step, if the doctors have an autorefractor, I can go ahead and add, and as you can see, it'll show as presenting as the RX type. So I'm going to change it to autorefractor, and then I'm just going to change it according to what I have in my autorefraction. So now that I have my autorefractor, and say that the doctor wants to base his refraction off of the autorefractor, what you can do is click on Copy, and as you see, it copies the autorefractor exact. So what you would have to do is change the RX type to objective or subjective or manifest. Then you can go ahead and change the numbers according to the refraction that you get. Now from here, if you wanted to do another refraction, or if you even wanted to finalize, you can just go ahead and click on Copy, or if you were doing another refraction, you can copy again. It'll copy the objective exact, and then you can change it again to cycloplegic or manifest, and then change the numbers again. From here, if you want to finalize the prescription, you can click on Copy, and then go to Final. Now once you finalize the prescription, you can go ahead and click on Transfer to Patient RX. This will actually make the prescription available for order. So this way, as you see here, the checkbox, when the front desk, they open up the patient profile or they open up an order screen, this prescription is ready to be ordered. That way, the front desk or the optician doesn't have to go back while you're still in the middle of an examination with another patient and ask if this is finalized, or they don't have to make the patient wait until they check with you to make sure that it's finalized. So it does save you time and save the patient's time, also the optician's time. If you notice also, I have this Add Vision Diagnosis that appears. So what this does, if I click on it, it's going to ask me if I'd like to add this diagnosis code. So I'm going to say yes if I'd want this to transfer over to the assessment tab. The same applies with the refractive charge if you charge for the refraction. So now that I said yes, if I go to my assessment, both my diagnosis and my refraction charge appears in the assessment. Other features that we do have in the refractive tab is printing out the prescription from here. You can also jump to an order screen from here. And then one last thing we have here for presenting prescriptions is a transpose button. So if you do have one of those prescriptions that come from an ophthalmologist that have a plus cylinder, you can go ahead and type in the prescription as it is. So I'm going to go ahead and add a plus cylinder. And if I click on transpose, what it actually does is transposes the prescription for me. So it's a nice easy step that they don't have to, it's a nice bonus for those who are entering presenting prescriptions or receive a prescription that have a plus cell and they don't want to do any math. So now we'll move on to the contact lens tab. Now the workflow is similar to the refractive tab. You can also use the copy feature as an easier way to document the trial lenses. You can also replace text, much like we did with the contact lens centration. You can do this through file setup, categories, and the brackets. You can also copy from the refractive or copy to the contact lens screen. Now we'll start off with adding a presenting prescription for contact lenses. So I have my summary tab here. Now the only difference between the contact lens tab and the refractive tab is the fact that it breaks down to 3 subtabs. So I have my summary, my detailed, and my contact lens history subtabs. Much like the refractive tab, on the bottom I do have this filter feature. So I can see all current prescriptions, I can look at the history. I can also filter with a type, so presenting, trial, and final. So now I'm going to go ahead and add a presenting prescription, and it's going to take me straight to the detailed screen. So I'm just going to add in a quick little prescription here. I can use my ellipsis button here. Now, the inventory, the way that it works is that I have my prescription set up, and it'll actually allow me to view all the available prescriptions or all the available manufacturers with that prescription. So my inventory isn't completely set up, so I only have these 3 that are available, but a really cool feature is the manufacturer. So you can actually filter with the manufacturer and see what's available. So I'm going to do Bausch & Lomb Pure Vision. I'm going to select it, choose my base curve, and then I'll do the same thing with the left eye. I have 2 different base curves. Okay, so this is my presenting prescription. If I look at my summary tab, it allows me to view that. So now, if I'm doing my contact lens fitting and I want to change the prescription a little bit, or if I want to even change the manufacturer, what I can do is I can go ahead and copy, and it'll copy everything exact, except it'll change the RX type to trial. So from here, I can go ahead and change my prescription if I need to, or I can also change the manufacturer. So if I don't want to use Bausch & Lomb, I can go ahead and choose Visticon. I'm just going to go ahead and erase my base curve and diameter. Or I can choose Clipboard Vision, whichever is available. Since I only have a multifocal here, well, I guess I'll use the multifocal. So I can do the same with the left eye, or if it's even the same prescription, I have my left eye equals to the right eye. So I can click on that and it'll actually equal the left with the right. As I mentioned before, I have the copy to contact lens screen. So this does come from the refractive tab, and if it is a very simple prescription, or if you want to base the contact lens fitting off of the finalized prescription, you can go ahead and click on this button and it'll actually transfer over to the contact lens screen. So I'm going to erase this. Okay. So now if I was adding multiple trials, what I can do, and what you can do with the categories actually, is you can name in the categories the RX type. So if you wanted to add trial 1, trial 2, trial 3, trial 4, and so forth, you can go ahead and add that. That way, when you're reading it in the summary tab, it'll make more sense and you'll see the order of the trials that you gave to the patient. So now once I have my trial, say I want to finalize the prescription, I can go ahead and copy once more, and it'll copy the exact same prescription, except this time it changes the RX type to final. Once it's finalized, I would go ahead and click on Soft Contact RX, just like I did with the refractive tab, and this will actually make it available for order. Same thing applies with the refractive tab. This way the front desk and the optician can open up an order screen or open up the patient profile and see that this prescription is finalized and ready to be ordered. This way they don't have to go in the back, or they don't have to ask the doctor if he's in the middle of an exam or with a patient, and ask them, if this is finalized or if it's just a trial, or whatever the case may be. Now, when I look at my summary tab here, you'll see in a nice, neat little order am I presenting to my final. And then also, as I did with the contact lens centration, if I double click, my options are here, so you can do this in the screen if it applies for you. I also have contact lens order history. So this is a nice, easy way for doctors to view if the patients have been ordering from your office and exactly what they've been ordering. Now I'm going to talk about the File and Interactions tab. For the File tab, you should scan important documents from leftover paper charts or even from information that the patient provides, such as a medication list or even documents from an outside physician, referrals, anything like that. So if you wanted to go ahead and attach a file or scan a file, if it's something that you already scanned in, you can just click on Attach File. You can attach it to the appropriate category here, or you can add and use your drop down here. Now, of course, this drop down you can change in File Setup and Categories. So if there's something that's really particular that you would scan, you would go ahead and do that. Another way that you can attach a file, you can go ahead and add, as I just did, and then you can click on View and scan the image or scan the file, and then you can go ahead and click on Save. Now we go into the Interactions tab. The Interactions tab is, I think, highly important, especially for the patient profile and the examination. The beauty about the Interactions tab is that anytime anyone accesses this patient profile or even the examination, it'll date and time when this was opened, and also who opened the profile or the examination. You can also add an alert. So if the doctor forgot to do something or needed to finish up something in the exam, you can go ahead and add yourself a little note and set it for an alert. This way, anytime you open up that examination, it'll pop up with the alert. The same thing will apply for the patient profile. So if they owe a balance, or if there's something very important that you or other staff members need to know and you need an alert, this is a great way to add that. You also have your messages, so if it's a really hectic, busy day and the doctor can't go up to the front and doesn't really have time to go up in the front and tell the front desk something, you can quickly add a message, and you can write the message here. It'll tie it with the patient number, also the examination number, and then you can go ahead and assign it or send it to anyone who is in your employees list and go ahead and send. You can always set a status, so if it's open, you can even do a priority from high to critical, depending on what type of message it is. And then you can see any messages created by yourself, messages assigned to yourself, or even unassigned messages. And last, we have the Correspondence tab. So anything that's electronically done, so if you emailed a patient or printed something out, it'll go ahead and document that in the Correspondence tab. Now I want to talk about interfaces. We do have interfaces with e-prescribing such as New Crop, so this will allow you to import outside medications and also electronically transmit prescriptions to the pharmacy. This will save you and your technicians a lot of time, especially for those outside medications. That way you don't have to second guess what type of medications they're exactly taking or search for the name or the quantity or the amount. This will actually give you all the information that you need to add into that examination, into that history tab. Now, My Vision Express exam does integrate with over 100 vision diagnostic instruments, and new interfaces are constantly being developed. This will help you streamline and optimize pre-testing. It will allow you to work more efficiently and deal with a higher patient load while reducing wait time and increasing patient satisfaction. You can also eliminate double data entry to avoid costly mistakes and reduce labor costs. You can easily access equipment results, which are automatically indexed by patient category and date. You can view a comprehensive history of results to monitor the progression of patient conditions. Another important feature that we have is the letters module. With the letters module, you can create specific letters such as referrals, recalls, and exam summaries. You can add brackets for multiple choices, just as I did with the contact lens centration. You can generate pre-appointments and recall letters, and these can be emailed to the patients, physicians, or even suppliers. This can be done as a batch or individually in the patient profile, calendar, orders, or exams. So I'm going to go to File, and I'm going to go to Letters. I want to show you a specific letter that I did. This one's for a cataract referral. I also added some brackets to show you exactly how that works and how it looks like when you access the Letters module within the examination. So I have my referral here for cataracts. As you see, I have a type. So it goes from calendar, exam, order, patient, prescription. Depending on what type of letter you're trying to make, that's how you'll determine the type. Since this is a referral letter for cataracts, it will be done through the exam. We also have an import feature. So if you click on the import feature, you'll be able to look at others' letters, and you can actually import it into My Vision Express, view it, and then if you like it, you can modify the letter, or you can delete it and import another one, or even create one of your own. Now I'm going to go into letter detail to show you exactly how this referral letter looks like. So I have all my merge fields and my logo set up here, and all your merge fields can be found here. The merge fields are done according to what type of letter you're creating. So if it's an exam letter, it'll give you all the merge fields for the exam. Same thing applies for the patient and the calendar and orders. So I've designed my letter and created it, and I have my appropriate merge fields. Now if you also see, I have here the brackets. So for this particular letter, I have my bracket, OD, OS, and OU. I also have another bracket over here for is frustrated by the decreased vision, has quit driving at night, and has completely quit driving. So now that I've composed my letter, I'm going to go ahead and save, which I've done so already, and I'm actually going to go into an examination and show you where this letter will pull from and how it'll look like. So I'm going to choose Darwin once more, and on the top here I have my letters button. So I'm going to click on my letters button, and I'm going to choose my referral letter. I'm going to preview the letter, and as you see, it'll allow me to select the text. So now all my appropriate information is now here. As you see, the merge fields have worked properly, and then even my OD has appeared that I've chosen, as well as has quit driving at night. Now this is when it comes to individually printing out letters for the patients. If you go back to the letters module, and if you go to the search, you you have your search criteria here. So you can search for a date range, a type, physician, insurance. Now this is the referral letter. So if I were doing a recall, I would click on my recall, and then as you see, the search tab changes a little bit. That way I can pull in all my recall dates, birth date range, last exam date range, and so forth. From here you can print labels if you're sending out postcards, or you can even email this to the patient. So once you find your search criteria, you'll have a list of patients here. And if you have their email addresses, then you can go ahead and email it to them, or you can print out a postcard for them. The next feature that we have is the coder. This can be found in any examination, regardless of the type of templates that you create, or if you don't create any template. You can use the checkmark button to access that coder, which helps you determine the optimal level of insurance billing for an exam. The billing level is recommended based on if the exam is for a new or an established patient, and criteria documented in 3 areas of the exam. So now I'm going to open up an examination, and I'm going to show you where you can find this coder. The coder is going to be right on the top here, the little check mark, the top right corner of your screen. When I click on it, you are going to see that there are different sections to this coder. So we have the established exam or the new exam, and it'll change right over here, and you'll see the 9 codes change as well. You'll see that we have history, exam, and then medical decision making. If you notice on the bottom of the screen, I do have this lime green highlighted field, and this is actually the medical decision making area. So anything around the examination that is highlighted in this lime green color does pertain to the coder. Now, as far as what these sections mean and the areas of the exam that actually determine the optimal level of insurance billing for the exam, we have the history. So this does include documentation in the HPI section of the complaint tab, as well as those in review of systems and past family social history tabs. You also have the exam, so this includes 12 elements of the physical exam in the entrance, external, internal tabs, and 2 elements of the psychiatric exam in the entrance tab. And then last is medical decision making. So as I mentioned before, it'll determine the complexity of the exam from straightforward to high complexity. So you can even see on the bottom here that you can, if you click on the button, you can go straight to that part of the examination. I haven't entered any information here, so that's why it's blank. Or also past family social history. I do have this tab that appears as well, and you'll see here the highlighted section, so I can go ahead and add more information from here. The next one would be review systems. So I have here that there were information documented, but if I clear review systems, you'll see that it's all highlighted in that lime green color. And then I have medical decision making, so that was on the bottom here, whether it's moderate complexity or low complexity, it was limited, minor, if the data reviewed was expensive, and the risk if it was from none to high. And you only need 2 of the 3. And then you have your procedure codes here that you can go ahead and choose. But they would recommend, so far with the examination that I've done, which I haven't entered much information, it is determining that this established examination is at a 99211. So you can go ahead and accept it, or if not, you can go ahead and choose a different procedure code. After all this setup and you're looking at the EMR and you're thinking, well, there's some things that you still want to change, modify, or even customize, we do have something called Customizer. So with Customizer, you can modify the screens, you can even modify reports and receipts. You can add, remove, or modify fields. You can add default values. You can add custom fields. So if there are certain fields that are not available in the examination or in the EMR, you can go ahead and use custom fields and customize it so that you can add those missing fields. Now, most screens in the EMR are customizable, and you can also create custom layouts per security groups. So if you wanted a certain custom layout for a doctor, but not the same one for a front desk or an optician, you can go ahead and do that with Customizer. You can also do visual changes, such as the color or the font, and even the placement of the fields. I do have 2 examples to show you, just to kind of give you an idea of what Customizer is capable of and what it can do. So for the first example, I do have on the very top, this is how it is originally. So this is the entrance tab that I have. And then on the bottom, this is done with Customizer. So as you can see, I have some added fields. I've arranged the fields as well. So it looks quite different than how we originally had it. The next one that I have is also done with Customizer, but this one is in the Contact Lens tab, in the Detailed sub-tab. So the top is My Vision Express as it is now, and then on the bottom it's done with Customizer. So as you can see, they've arranged, they modified the fields, they've rearranged the fields as well on the screen. They've even added some highlighted sections, so in green and blue. Well, I do want to thank you for attending the webinar today. If you have any questions or if you seek more information, please contact us at 1-877-882-7456. Extension 3 is support, or you can also contact our sales department if you were interested in ePrescribe or any of the interfaces or even Customizer. For those who could not attend today's webinar, came in late, or would like to see the webinar again, we will be posting this in our support center at myvisionexpress.com. We will now begin the question and answer portion of the webinar.